Hi, Dr. Larry Altshuler here, talking to you about healthcare and healthcare reform. Telling you things that you will not hear from the media, and you certainly won't hear from the politicians. Now, this short clip is the third in 3 videos that talk about the dysfunction of our healthcare system and what is the major problem that causes that dysfunction. In quick review, I've told you that we waste a tremendous amount of our healthcare dollars, almost $1 trillion a year. I've also told you that that waste is caused by technology and our system, which is specialty based, which leads to a lot of unnecessary and ineffective treatments that are very, very expensive. And finally, in my last video, I explained to you how all this waste continues to be perpetuated because it is paid for by the third-party payers, the government and health insurance companies that pay for all this unnecessary care. So with that in mind, this last segment about dysfunction talks about why we can't change this and why it doesn't look like it's going to be changed, and why both political parties really are not addressing this directly. So let's find out why this is. Well, we know the third-party payers pay for the waste. But here's the thing. Who makes those decisions? Who decides what is going to be paid, who's going to be paid, and how much is going to be paid? Because that is really the bottom line. Well, here's the thing. There is a committee called the RUC, the Relative Scale Value Update Committee. This is a committee actually formed by the AMA, but it actually works for Medicare and the insurance companies, and this committee is in charge of deciding all the reimbursement for every test, procedure, and treatment that's done in the United States. So already you can see that this committee is very, very powerful. Well, let's look at the makeup of this committee. This committee has 29 members. Now, 27 of those 29 committee members happen to be representing specialty organizations. That's right, 27 out of 29. I don't have to explain this to you. They are from specialties. They're going to look after themselves. They're going to preferentially reimburse specialty care and not primary care. And that's very expensive and very wasteful. Now let's talk more about this RUC. They meet in secret. They make all their decisions in secret. They receive no input from outside. They don't go out there and ask for feedback. They make the decisions. And so they are, again, very, very powerful. And you might ask, well, what do they base their decisions on? Well, there's actually 3 factors. Now, some of these factors are okay, some of them are not okay. Number 1 factor, malpractice insurance. If you pay more malpractice, they're going to reimburse you more. Obviously, it'd be great if we had some malpractice reform, but the Affordable Care Act doesn't do that at all. The Republicans, theirs is not going to work, as you'll find out in future videos. So that's 1 factor. The next factor is called work units. Now, this includes skills and training. And I think that's fine. I think you should reimburse more money to those people who have more skills and have more training, to the specialists that have that. I think that's okay. But work units also include effort and stress. And I can tell you right now that those are 2 areas that are very difficult to pinpoint. But the RUC thinks that specialists give more effort and have more stress and therefore should be paid more. The third factor is overhead. The more overhead you have, the more you're going to get paid and the more you're going to get reimbursed. Now, this is really a problem, because if you go out and buy some equipment that costs $1 million, the RUC is going to make sure that you can pay yourself for that. The fees that you charge can be very, very high so that you can get reimbursed for that. What they don't do is care whether it's going to work or not, whether it's ineffective, whether it's overused, whether it's unreliable. They don't even consider that. The RUC does not consider outcome. They don't consider how this technology or this treatment is going to affect the health of the people that it's being used on. That's not considered at all in reimbursement. So they'll pay more and more and more for overhead, even if it's totally unreliable, ineffective, and unnecessary. Now, how is this based? All these factors are actually based on surveys that go out to specialists. And these specialists respond about their malpractice and their overhead, and that's what this formula is actually based on. Many experts have looked at these surveys, and there's no question they are very biased. They obviously are looking out for themselves. They're arbitrary and they're capricious. In other words, they're not based on any scientific data. But yet, our entire reimbursement system is based on these decisions. So you can tell that we really have a problem, and that's why the third-party payers are still paying for all this waste. Now we come to the point, okay, well, why don't we do something about it? We know what the system is. We know we waste. We know where the waste is coming from. We know who's making these decisions. Why can't we change the system? Well, the fact is that the politicians won't address this issue, neither the Republicans nor the Democrats. They won't address it right on directly. The reason for this is because every time a test, a procedure, or a treatment is done that is wasteful, someone is making money from it. And that money can be a lot of money. And so they don't want to give up their bread and butter. This is what they make their money on, even if it's wasted. So they're going to do everything they can to make sure they keep that money coming in and keep getting paid. Okay? Well, if you make all that money and you have all that ability to continue getting paid, guess what you get? Power and influence. And I guarantee you that that's what they use to keep the bread and butter coming in. And that's why the politicians are afraid to directly address this issue, because they know that there's going to be a lot of people who are very angry if they say, we're not going to pay for this waste anymore. Unfortunately, folks, this is the system that we now have. And as you will see in the future videos, neither the Affordable Care Act nor the Republicans are addressing this issue of waste and the preferential payment system. So with that in mind, I want you to see all these videos, because now you'll see why the reforms aren't really going to work effectively. Come to my website, balancedhealing.com. You'll see a list of all the videos, but you'll also get a lot of information that will help you navigate the healthcare system and make sure that you don't waste your time and money in getting cost-effective healthcare. So in the meantime, thank you for visiting with me, listening to the video, and I hope you visit me again and watch all the other videos. Thank you.